know, one of the things I love most about this preventative health awareness movement are the people, the professionals, the committed and dedicated humans that are aligned with this mission. And today is no different. When we're talking about this mental health and addiction story, we need to add to the family in a big way in order to create legacy change. And you know, life sometimes just happens for us when we least expect it. And this next FAMBassador, our latest and greatest FAMBassador, happened by accident. As many of you know, I'm honored to be working in collaboration with OsteoSound, and we were doing a bone scan in Paris, Ontario. And this wonderful human, actually, because she is the CEO of her health, she came to have her own bones checked. But something much bigger and greater happened there. A deep and meaningful conversation that lasted a long time. And then it continued on the phone afterwards for a couple of hours. And that's what has brought Christine Squires into the studio today at PHAMCAST to join not only the family, but this Real Lives Touched by Addiction movement, because you're not alone. Christine, so excited to have you here. You've worked in the mental health and addiction space for many years in many different capacities. What was it like when you sort of heard what I was doing and how it resonated with your mission? I mean, it was really cool to watch how our conversation just organically unfolded.
It's an opportunity to communicate directly to someone's heart that there is other ways and other formulas that can help you get to your path, because no path is set in stone. Every path is not linear. We all are responsible for learning and finding our own journey.
Yes. And so when you and I are sitting across from one another as complete strangers, what was it with FAM that really resonated with you?
The like-mindedness.
Yes.
And the willingness to learn, to grow, to evolve, and not be an autopilot, which
Yes.
is something that a lot of people experience.
Especially in this space.
Especially in this space, and especially when you've experienced trauma, addiction, family dynamics.
Yeah, and what I love also when you say about learning and growing, we're doing this to help others. But what's been really cool from my lens has been to see how the connections and the learning that's happening between the FAMBassadors. So you've just been brought into a fold today with the other guests that were on the show, the other FAMBassadors that did the event back in February, but they embraced you with open arms because they want to learn from you as you want to learn from them. And that helps us be better together, linking arms and moving forward in a way that can really create true change with real people sharing real stories, layered with professionals like yourself. Did you get that feeling too?
100%.
Yeah.
And that's part of my personal ideology as we're developing our products, is that I've always worked on a multidisciplinary team. And so we brought that into this business model where we have psychologists, dietitians, occupational therapy, social workers, all working together to look at the whole person.
Yes.
So that the needs aren't siloed or missed or skipped.
Yes.
So we have an opportunity to bring the whole person to the forefront and say, what is it that you need?
Did you hear that? She asked a question, what is it that you need? And you said at the very beginning that every path and every journey to recovery is different. And I love that as a healthcare professional myself and somebody that lays their hands on the mind-body connection as a massage therapist, it's real. You know, I've worked, with people struggling with addiction and in recovery. And it's incredibly powerful. And that's where when we break down those silos and we work better together, the true recovery can happen. So, I know that you've worked in multidisciplinary teams, but how did you come to, because I got to tell you, I always love to be the first to kind of do something. It's kind of my way. I like to be not just the first from a vanity perspective, but because when I see a disconnect, we want to create change, and you want to be part of the solution, not the problem. So I am so honored and beyond excited because hot off the presses, it's actually not even off the presses yet because this hasn't even launched, but you have honored us with coming into studio to talk about this incredible resource, the Addiction Recovery Calendar that you created. Let's talk before we dive into what it is. How did you come about to even think of wanting to create this calendar?
I saw so many people that were struggling with family dynamics, communicating about what their actual objectives were, or how much progress they were making, or feeling shame when they didn't feel like they had as much progress to share. And so I wanted something that explained all the different layers to recovery, and that it was accessible to anybody in the household that wanted that access to that information. Because sometimes when you're in that environment, the conversations are, well, what did you do today?
Right.
And it's not about rebuilding the relationship. It's about, I guess, getting to the end of the conversation
Yeah, they're almost
without
on
having
trial.
a conversation.
Yeah, yes.
So it's really difficult to feel that, and I wanted to take the conversation out. To extend that, there's also patients that can show their physicians, like, I am making progress towards getting, like, some people are looking to titrate their medication down, their substance use down, so that they can start to try a different medication. Like,
right.
If we were to trial you off an antipsychotic medication, then we need to have consistent tracking
right.
to reduce that. And I know it's an important thing
in a
for
safe
you,
way,
but we have to do it in a safe way where
yes.
we know that there isn't going to be any residual psychosis.
Right.
So there's lots of reasons that you can work with a physician with this system, with the CAS, with like probation, to show your invested efforts in your recovery actions.
So powerful, guys, because it's having people go inward and connecting the mind and body, but also bringing community and family into recovery. Brilliant, Christine. Brilliant.
The next section is about 3 different options. It's kind of a choose your own adventure. One, it can be used for people that are trying to cut down if they're actively using. So if you have the opportunity to say, I'm using 3 tall cans and smoked half a joint, you write it down, right? You develop your own shorthand and in the notes above, so that you can keep track better. But you track how much am I using, and you're accountable to that. So the goal is never to use more than that, and that you continue to titrate down. The other opportunity that you have for that green section with a compass is to track your urges and cravings, because that's indicative of where you're at with post-acute withdrawal and how much it's impacting you, which again comes back to energy management.
I love this, and I just want to, because you've got years of experience, and you've worked with people in all stages of recovery, and everybody's recovery journey is different. So some people stop, they go through withdrawal, they stop court circuit. You're talking about, so talk to help explain to people that post-acute recovery. Explain what that definition is for those that don't really know what that means.
Well, everyone's probably aware that when you stop consuming illicit substances or alcohol, that there is a high risk for seizures, for death, for DTs. They are invasive and they cause high risk.
Right.
So if you've been drinking alcohol for long periods of time, it's something that everyone should be aware of. And at that time, if you're starting to experience withdrawal symptoms, you can either go straight to a hospital, or you could have 1 drink to see if you can lower the intensity of the symptoms. Post-acute withdrawal is that from 3 days to 2 years. It is a long period of time that impacts our sleep, our cravings, our urges.
That's why I asked the question, and let that sink in. It doesn't happen overnight. And we have to give ourselves some grace, and we have to work our tools for years to come. And I think that's important. And what I love about what you're doing is giving a tangible tool to make that doable, to help people when they're feeling overwhelmed and don't know where to turn. So thank you. I didn't mean to interject, but it's such an important conversation, because when you're in something and in this field, you really, you know a lot. But there are people out there that are lost, and families that don't really know and maybe don't have that experience. So thank you for clarifying that. And what else is in the?
So not just with cravings and urges, because when the craving and the urges are high, we tend to use different skills to be able to cope. So it could be a higher amount of skills that are rooted in distraction. It could be a higher amount of skills that are rooted in connection. But having your day and your week and your month planned around periods of time when the triggers are higher is super successful. It's like Success 101. The more planning you do and the more people around you that are like-minded, who are aware of the plan, everybody's going to get brought up together and be successful. The last option with using the compass is tracking your mood.
Right.
Because when you're experiencing post-acute withdrawal, you're experiencing a lot of irritability,
yes,
a lot of crankiness, and it's, again, what can I do to give myself grace? What can I do to be aware of how I might be projecting that to other people? That interacts in the house. So everyone's aware of what their needs are, and that we're doing the best that we can with the time, energy, resources, and capacity that I hold right now. Not what I should have had, not what I could have had, not after 4 years of recovery, I'm still here. This is just where it's at.
I love that. So I think it's really important now to bring into the conversation, Luke Laughlin has been a FAMCAST from day one. He is working his recovery every day. And Luke, you've been part of this conversation in this show today and part of the FAM movement. And you are open about you're working your recovery each and every day. You just met Christine and this incredible tool. I just want to get some feedback from your lens of somebody that's living this. What do you think about this and how that could be of help to you and your family?
I think it's brilliant, like absolutely brilliant, because before recovery, I had no structure in my life, waking up all different times of the days if I even went to sleep. So I use some stuff similar in the morning and at night that you've talked about here, but just like the calendar of breaking it down, talking about the acute withdrawals, like I've felt that. My emotions are all over the place, and with the family being involved, I can be so worried to I don't want to worry my mom and dad if I'm not having a good day. So I feel like bringing the family involved with this and to see it is great, because it's taken me a long time to be able to say to my loved ones, I'm not having a good day. I apologize if I was a little short with you today. I'm tired. You brought up the thing, you might just have enough energy to do what you can for today, and I'll think I need to overcompensate because of my past and have to do more and more things where I don't. I'm on this journey, I'm right where I'm supposed to be, and I just need to take it one step at a time, and this kind of gives you that layout to take that one step at a time. And I think it involves the family members, like you said, which I think it's great, because we are a team in recovery. Everybody needs to be on the same page with communication so we can deal with it, right?
Yeah.
Recovery isn't just 10% in the recovery session at all. It's 10% there and 90% what you do with it.
Yes.
And family members tend to over amplify the need for that 10%. Well, I want you to be in there not just once a week, 4 times a week.
Yeah.
And that's not what's needed. What's needed is the reflection time to build out, start planning for your future, because having hope for the future is also an agent of change.
Yes.
So it's not just one thing. And I do, FAR Canada has an amazing program that helps families with understanding in group settings and one-to-one about what their children's needs are. But I hope that this will be an ongoing tool that could be used in recovery centers when people are exiting.
Yes.
That it can be used for people that are coming out of hospital from, having been in the CTU for 4 weeks. So I hope that it's integrated everywhere. And as our very small brand starts to grow, our commitment is to create educational videos that not just provide information, but provide the background to make everything work better. Because there is a limitation in healthcare and what we actually are presenting to folks when they're in the settings.
So beautifully said, and this is what FAM is about. And Christine, thank you for actually rolling up your sleeves and putting your knowledge, your experience, professional experience in this space to work with an actual hands-on tool that I know is going to be invaluable. And we are going to do everything we possibly can with the FAM movement to elevate this. You've been so generous. You're giving out a discount code for FAM. That will be available. You'll see the discount coupon code, and you can take advantage of that. And of course, I hope you're going to come back on the show, and you're going to be part of the family now. You're not getting away from us now. You're part of the family, and you're not going anywhere. You know, it's amazing to me how when we are open to creating change better together, the universe brings people together. Thank you for this conversation. Thank you, Luke, for joining us. And thank you, all of you at home that are listening and continuing to help fuel this mission of change in this mental health and recovery and addiction space. It is critically important, and we're just getting started. So make sure you continue to follow us on here on PHAMCAST. Reach out to us, engage with us. Tell us what you want to hear about. And join the family. Make sure that you're having your voice heard, because we all play a role. But know this, we are in this together, and you can become the CEO of your health. And together, the future of healthcare is going to be hopeful if we have anything to do with it. Take care, everyone. Until we see you next time, remember, a healthy tomorrow begins with prevention today. We'll see you all soon.